Good afternoon. My name is Jane Mwamba Mumba, and I am part of the Southern African Leadership Cohort of 2025. My project is entitled Demystifying Family Planning for Female Medical Students. I hail from Zambia, and I'm a consultant obstetrician gynecologist. I'm also a medical superintendent for a first level hospital, which is a public health institution. Why did I pick this project? I had observed a large number of young students coming in for emergency post-sexual activity care and not making intentional choices about their sexual health. Digging deeper, noted the lack of assertiveness in asking for these options for themselves in relationships or even from health facilities. There was a lack of mentorship or a safe place for them to speak freely about what they were up to and how to get the help they needed. I noticed a risk taking without the tools to understand the risks that you were taking. What does the data say? Innovations for Poverty 2024 found that 60% of female students were pregnant in college. Though modern contraceptives were available, there was low uptake. The Zambia Demographic Health Survey showed a high adolescent rate of pregnancy. The CIDA's 2023 report in Zambia showed that 50% of the new HIV cases were highest amongst the age group of 10 to 19. So we're seeing unintended pregnancy. Why? Is it stigma? Whether self-stigmatization of society? Is there misinformation? What is the issue behind all of this? The ladies are getting the medical education, but it's not translating to quality choices for their lives. Are our interventions not attractive enough? This required thinking around the box. So I collaborated with Say What International Zambia, which does a lot of work amongst universities, the Youth SDG group from the Said University. The MOH would be involved in this through the teaching hospital and the district clinics, the university authorities, the university students themselves, and the parents or guardians. What would this do? How would we do this? We needed to strengthen university clinic, the peer-to-peer support. Maybe if it was coming from somebody of their age group, it would get through. Strengthening of family planning services, even at the main hospital, so that it is friendly to the students and they can easily walk there or know about it. The digital survey to understand what is failing us and why. What were the challenges observed? The reluctance to speak openly about sexual activities and thus articulate needs adequately. The attitude of providers towards teenagers or young adults seeking family planning services. The bureaucracy involved in upscaling such a service, not only from the place of the law, but even parents themselves. Would they be for this? The financial implications, the human resource, the infrastructure angle, and even the general consumer was required at a large scale. What were the learning points? What did I pick up? Authentic leadership. This is a passion in my field. And I loved speaking about it and speaking to young ladies and seeing them make these decisions. It reminded me of my earlier whys I chose my profession. Inclusive leadership. I had to sit in rooms with young men and women who are very smart, listen, make space and take space as well. It was a huge leap for me because I tend to be very quick. Strategic leadership. I had to work with some of the people in this space and see how we could pool resources, but I had to lend my voice and lead the conversation. Sustainability, it's about how to go on, how will the university sustain, allow the students to do this so that they find more ways and better ways, allow the university to actively take it up, and partners who would be willing to go forth with the same idea. A way forward. How do we take this to other tertiary level institutions? How do we involve other youth organizations? How do the students become the advocates, the voices by themselves and champion this? And how do we capacity build both in the youth advocates and in the lecturers and teachers who are encountering the students every day? To the future. An African girl who believes in herself changes not only herself, but her environment flourishes as well. I thank you for listening.